Well, thanks for having me here today, and thanks, Laura, for introducing me already. But I imagine no one here knows who I am. So I'm Poppy McNally. I'm an assistant psychologist at the Royal Liverpool Cancer Psychology Service, and I also work with Laura at the Liverpool Ocular Oncology Centre. And I'm here talking today about sleep because, given that it's inspired by my work that I do at the Royal within the service, given that we know that people going through cancer struggle a lot with their sleep. I'm sure we can all relate to that at some point in our lives. So it's not to say that I'm a sleep expert. My expertise do lie in psychology, but if there's anything here that you pick up that you might find useful, then you can try it. So for the first half, I'm just going to introduce sleep and the importance of sleep, and then a little bit about the sleep cycle, just so we can sort of understand what our brain and our bodies go through during the night. And I'm going to touch on some dreams, nightmares and sleep disorders. But just a disclaimer that this talk is for managing normal sleep disruption, not for any kind of sleep disorder, but signposting to where you might be able to get some help for that. And then moving on to part two, ways of managing sleep. So our sleep hygiene, which is just a term for our the behaviours and lifestyle changes that we can make that can set us up for a better night's sleep. And then managing worry. Like you said, it's a common issue that's reported by people if they're going through a difficult time. So just looking at some things from cognitive behavioural therapy and some techniques on managing worry with breathing and relaxation as well. Don't worry, I'm not going to make anyone do a practice here right now, but it's just something that I can sort of point to that you might be able to put into your routine. And then at the end, I'll have any information and resources that I've gone through today. So if anyone wants them, they can ask me at the end and I can get them sent out to you somehow. So yeah, we'll start with the background. So yeah, like I said, so this work is inspired by my work that I do at the Royal within the Cancer Psychology Service, which is open for anyone who's on our therapy waiting list and anyone who's recently finished therapy, given that you can't access the group. We run a sleep group for anyone who's experiencing sleeping difficulties, but you can't access therapy at the same time. And it runs for 3 weeks, there's 3 sessions, roughly an hour and a half. So I've been trying to take bits from there and add some new stuff into it. So it's going to be a bit longer than Laura's, so hopefully I don't actually send anyone off to sleep, but just to bear with me that it's usually a 3-week sort of group that we run, so yeah, trying to shorten it down. And the group is actually open to caregivers, carers as well, given that we know that it's not just the patient that often ends up struggling with sleep, so they are welcome to come as well for our patients. So like I said, it's a really common complaint. Got here, one study found 60% of people with cancer struggle with sleep or have some sort of sleeping difficulty. And then more generally, to start off with some facts here. So it's recommended that we have about 7 hours sleep minimum, 7 to 9 they say, just to sort of maintain our optimum functioning. So that's reducing our risk of sort of heart disease, strokes, etc. But that actually a lot of us aren't getting that. In fact, 1 in 5 people are reporting that they don't get enough sleep, which is actually quite a lot. But of course, everyone's needs for sleep are different, and this can change with age and gender. So as we get older, our melatonin production reduces. So it's often a common complaint as we get older that our sleep is something we struggle with as well. And like I said, there's gender differences, so actually women tend to need more sleep on average, just due to sort of regulating the hormones that we have. So one study found 11 minutes extra sleep is needed, and actually more deep sleep. But yeah, there's many different reasons for that as well, such as going through menopause, and we know that hot flashes, etc., pregnancy as well. So there's gender differences too. And that overall that our sleep is influenced by our internal body clock, so our circadian rhythms, which run on a 24-hour clock. And this is influenced by these external cues that we have, so like the light and the darkness, but also this sleep drive, which we have, which builds up throughout the day and is only relieved by when we sleep. So why do we sleep? Well, it's vital. It helps us process information, helps with our memory. You might find if you're not sleeping, you're quite forgetful, you can't concentrate, so it's actually really important for processing and remembering information. It helps us restore our energy. Obviously, we don't feel as tired when we slept. and repair our bodies, because during the night, all of our important growth hormones and repair of tissue, etc., happens when we're asleep. I just thought this was interesting, this part, specifically about why we experience this paralysis and we can't move when we're asleep. It's thought to be because it's to stop us from acting out our dreams, or potentially so we don't wake ourselves up from an evolutionary point of view. And like I say, you can probably recognise some of these for yourself of when you get enough sleep. Improved memory, more efficient, creative, fewer injuries and accidents. That's because our judgment is better, we're more alert, more aware of our surroundings. It's actually reduced stress and improved mood. And on the other hand, we could probably recognise how we feel when we don't get enough sleep. Like I said, there's issues with memory, generally feel tired, fatigued. You also might find that you're more emotional, more irritable. That's what we hear a lot. This can often then affect your relationships because you're getting a bit snappier, not being as kind as you usually would due to this lack of sleep. But also that it gives you a sort of low ability to manage stress and pain, and you might find that you get more common colds and ill when you've not been sleeping regularly for a long amount of time. So this is just sort of summing up how important it is. We all know how we feel when we don't sleep. And so the sleep cycle, so it's generally considered there's 4 stages of sleep. There's 2 different types of sleep. So there's REM sleep, probably heard of, rapid eye movement sleep, and non-REM sleep. So it's characterised by different brainwave patterns, and also the fact that your eyes will be darting about or they won't. And this is just to say that we go for about 4 to 6 of these every single night, and they last for roughly 90 minutes. And this is important because actually where you wake up during the sleep cycle affects how you feel. So if you wake up during the light sleep stage, you will feel it's easier to be woken up, but you also feel more refreshed. And so light sleep makes up about 50% of our overall sleep. And actually, in this transitionary phase between being awake and light sleep, that makes up anywhere from 2 to 5% of our overall night time during the night. So we're actually awake quite a few times, and it's normal to be awake a few times within any night. And often we hear, obviously, from patients who've had a nucleation done, this could be a trigger sometimes, closing eyes at night, and sort of seeing the visual symptoms of this, that can be a trigger there. And so we have this awake stage into light sleep, and then we have deep sleep. And like I said, if you're woken up during the deep sleep stage, you will feel quite groggy, of course, because you are more in the deeper stages of sleep, more disorientated as well. And then finally we have this REM sleep stage, so probably heard of it, it's the dream stage, so it's generally known as where most of our dreams will happen during this part of the night. But it's also involved in emotion regulation as well, and memory, like I said before. And that actually people who are blind, they will still have REM sleep. People who are born blind might just dream in other senses, and they will have REM sleep, but it's often thought that they'll have fewer eye movements during this stage. So this just say as well, it's about quality sleep. It's not just about the numbers of hours that you've got, it's about going through this sleep cycle non-disrupted a good few times every night. Okay. And this is just a graph taken from the Sleep Foundation website, which we signpost to a lot in our group, which is actually really useful if you've got any questions or want further information about sleep. I would recommend the Sleep Foundation. So this is just to say that we experience more REM sleep throughout the later stages of the night, and our deep sleep reduces. So you might find that you will dream during the later stages of your sleep. And dreams, I thought it's important to talk about this, given that that we know that a lot of people, they don't understand why they dream and they try to interpret it, but there's not actually one way of or method of interpreting dreams. It's more about your own meaning that you draw from it. But why do we dream? So earlier theories, you've probably heard of a man called Sigmund Freud. He's very big in psychology. So he had something out called the interpretation of dreams, and this was all about expectation fulfillment. So that dreams are an attempt of the unconscious mind to resolve some form of conflict. And we've sort of moved away from those theories a little bit more, but they were onto something, and older as well, they were onto something that there's some sort of problem-solving function, perhaps. But we moved on now to realise that it's more to do with processing of our emotions and consolidating and processing information. So our brain will sift out unnecessary information and keep things that it should remember, ideally. So processing emotions is important because, see, when a lot of people receive a cancer diagnosis, they're taking in a lot of information. There's a lot going on, not just them, for those around them, and it's a lot to process, and it can be quite overwhelming. So you might find that during this time you might have some quite strange dreams, but really it's just your brain trying to make sense of what's going on because of this emotion regulation aspect of it. And like I said, you can try and interpret your dreams, but it's not always the most useful thing to do. Sometimes they just don't mean anything. And nightmares as well. Obviously, this might be more frequent for people going through a difficult time in their lives, for obvious reasons, again, because it's about this, your brain just trying to regulate your emotions and make sense of things. But it can be more likely when you're under stress, when you have different mental health conditions. And it's normal to have occasionally nightmares for everyone, but only about 2 to 8% of adults have a problem with sleep, which is regular. So we would say if you're having these at least once a week and they're affecting your daily living and you're quite distressed by them, and that if they start when you start a new medication, then perhaps speaking to your GP would be a good idea. But generally, these might be more common when you're going through a cancer diagnosis just because of the stress that's been caused. So generally trying to manage stress can help with nightmares. Trying to limit stimulating activity before bed as well can help, or any distressing content. Reducing that before you go to sleep can be helpful. But also that keeping a sleep diary can, just so that you can start to spot when you're having nightmares and see if there's anything different that you're doing in the day that is affecting that. Also, I wanted to point to Dr. Justin Havers. So he has a technique, it's a self-help technique, and there's a YouTube video here, and it's about 10 minutes. I'm not going to play it today. But he uses this for people suffering with PTSD, nightmares, but it's also quite relevant if you're having nightmares that are quite recurrent and you're finding that you're quite distressed by them. So he outlines this self-help approach, which is it's really cool, actually. So it's based on imaging rehearsal and it's dream completion. So it's the idea that that we have nightmares because our brain's natural healing process has been interrupted, and the brain can't figure out an ending because it's been that intense that you've woken up, or that it's run out of ideas, so you sort of get stuck at this nightmare and you wake up and it's horrible. And he outlines this approach where with dream rehearsal and thinking of a positive end and taking control of your dreams can actually help you finish that with practice, and can actually help you get better with nightmares that you might be having. So that's one thing that you can do to help for that. And look, disclaimer, like I said, this is going to be managing normal sleep disruption, because insomnia, quite often we have patients say that they've been suffering with insomnia for quite a long time, but it's actually a clinically recognised disorder. So it's in the DSM-5. So it says here it's 3 nights per week for at least 3 months, having difficulty sleeping, significant distress in daytime performance, and also not explained by another sleep disorder or medication or by a psychiatric disorder. So it's clinically recognised, which is important because some of the things I talk about today might not necessarily help someone who's been diagnosed with insomnia, but it's always a good place to start trying out these techniques first to see if they work. And obviously always just talking to your GP if you're concerned about insomnia and it's affecting your daily living. But there's also some help online that you can get, is the Sleepio app. So again, it's based in CBT. It is available on the NHS, but not in all areas. And it offers a 6-week program, which personally adapts to your progress. And you can sort of learn some CBT techniques in managing sleep. I think there's a diary on there, and it's all managed by a sleep expert. And there's also this therapy, so CBTI, so cognitive behavioural therapy for insomnia, and it's based a lot in sleep restriction, which is where you would reduce your time in bed to the hours that you're currently sleeping. But we wouldn't recommend this for anyone who's going through cancer treatment, just given that rest is really important. So we wouldn't recommend restricting your sleep in any way, but that's just to say that that's how some people do manage with insomnia. Okay, and lastly for this half, again, I mean, there's so many out there, but today is managing normal sleep disruption. But it's just to say that, so there's sleep talking, which is one of the more common ones. About 66% of us will have this at some point in our lives. Sleepwalking, sleep-related eating as well. So people can get up and make whole meals and not even remember they've done that. And sleep paralysis, night terrors, bruxism, so that's teeth grinding, restless leg syndrome. Just to say that if you're concerned about any of these, then it's always best to speak to someone, but today is just managing the usual sleep disruption. Okay, so that's the end of just a little bit of background about sleep, really, and why it's important. And then ways of managing sleep. So probably heard this term, sleep hygiene. Like I said, it just means the usual sort of routine and behavioural changes, lifestyle changes that you can make that will set you up for a better night's sleep. Then managing worry as well, and relaxation and mindfulness. And I think before starting to manage sleep, it might be worth looking at what the cause is and trying to figure out what is the issue here before you go in and change anything from your routine. So sleep hygiene, probably heard about a lot of these already, but so in the AM, it's best to get up and get some natural light within the first hour that you're awake. You should be getting about 10 to 15 minutes of natural light to get the vitamin D and to also regulate those circadian rhythms so your body knows it's time to be awake, which I know is not always easy when it's raining here all the time, but you can get these sun lamps, which are quite good, which people use in seasonal affective disorder. So getting one of those might be an idea if you're not getting enough sunlight in the morning. And then food, caffeine, stimulants, again, usually don't affect you at night if taken in the morning, so that's okay. And it's also about keeping active and engaging with people. I mean, it's always better to leave the house, even if it's just a short walk. It's not to say go to the gym, especially if you're feeling unwell or you're not physically able to at the time, but just leaving the house, getting fresh air, speaking to people, interacting with people will set you up for a better night's sleep. And naps as well. So naps generally in the AM won't affect your sleep in the evening. But as a rule of thumb, we say no longer than 30 minutes if possible. And that's because it disrupts this natural sleep drive that we have, which builds up throughout the day. So that actually by napping for a long time and frequently, you can disrupt this and actually use up some of your sleep that night. So some people like to schedule in an activity for around the time where they would usually nap, which can be quite helpful. And pacing as well, which is used a lot in patients when they're coming to us with fatigue and issues with fatigue. I'd say that usually the distinction between fatigue and sleep is that sleep is feeling tired is relieved by sleep, but fatigue, sleep doesn't necessarily relieve that. So what we would suggest is pacing energy, and it's stopping activity before you get too tired. It's starting with tasks which are more difficult when you're feeling more awake and more alert, and it's just breaking up tasks so that they're manageable throughout the day and thinking about what's possible given the amount of sleep that you've had and your energy levels that day. And for the PM, so baths at least an hour and a half, 2 hours before you go to sleep. I know some people might have a bath because they think it relaxes them, and if that works for you, that's great. But the idea here is that it raises your body temperature, and to sleep we need a nice cool temperature. So trying to limit baths too close towards your intended bedtime. Foods rich in tryptophan, so this is things like cheese, milk, cereal, turkey, any poultry really. And because this is an amino acid thought to be involved in sleep and enhancing sleep and drowsiness. So yeah, you can have a slice of cheese, it won't give you nightmares or anything. It might actually be quite useful. And again, the environment, so dark, because of this melatonin, which is produced when the eyes receive dark lighting, so quiet, cool, also tidy as well, not having anything too stimulating in the room, perhaps turning clocks away from you, so you're not watching things around the room, which might keep you awake. And again, so nicotine, caffeine, stimulants, Again, as we know, they're going to keep you awake in the evening if taken too late. So just those general things with smoking, it might be affecting your sleep if done too late in the evening. Alcohol as well, of course. You might find it really easy to get to sleep at first, but it's actually disrupting your sleep and your sleep quality. So again, just as usual, trying to limit that. And also heavy foods as well. So not having anything too heavy, too acidic, and sort of trying to have frequent but lighter meals can be helpful. So our digestive system isn't trying to work, which can keep us up. And also just going to the toilet as well before you go to sleep, so you're not getting up in the night. Emptying your bladder is always a good idea. And strenuous activity, again, not too late in the evening, just because it raises our body temperature, which we need a nice cool temperature to be able to go to sleep. And electronic devices, again, I'm guilty of it as well, being on my phone, which is not the best idea, given that we know that blue light from that inhibits this melatonin, so it might be affecting your sleep that as well. So maybe trying to read instead, or engage in a different activity. So that's not to say that you have to do all of these and that these will all work for you, but that this is the general sort of sleep hygiene that we would recommend, and it's just about seeing what you might be able to get into your routine that you're not doing already. Okay. And again, with any medications and herbals, some people find that these work, although evidence is mixed. They can be useful if taken properly, but always check with your GP before taking anything like this in case it sort of interacts with any other medication that you're taking. And again, melatonin is usually only prescribed for 1 to 2 weeks because of the sort of addictive qualities to that. And also being aware of any side effects and temporary side effects from medication. A sort of signpost here to cancer research and to Macmillan as well, who have specific information regarding cancer and medication. So, okay, so managing sleep, just bearing in mind the sort of sleep hygiene that I talked about. What's a good idea usually is to start with a sleep diary. It's usually the first call, so you can sort of, it's quite small, no one's going to be able to see that from that far away. So we have here sort of what time did you go to bed last night, what time did you wake up this morning, how long did it take you to first fall asleep, and all of these different questions for each day of the week. And there's a morning one and an evening one, and it's trying to start filling this out and bearing in mind the sleep hygiene that I talked about, and seeing what you did that day and seeing how you slept, and trying to spot any patterns between behaviours and good and poor sleep, and usually trying to do this for at least a couple of weeks so you can start to see those patterns is a good idea. And also trying to do it as soon as you wake up so it's fresher in your mind as well. And another one is the 30-minute rule. So usually if you're not falling asleep within 30 minutes, it's a good idea, if possible, if you're feeling well, then to leave the bed and to leave the bedroom and to go somewhere else, and to not go back to sleep until you're actually feeling sleepy. And why this is because we're trying to build that association with your bed is for sleep and for when you're feeling sleepy. And so they might say go and engage in a non-stimulating activity, so maybe reading a book, doing something that calms you, something relaxing. And if you're not able to leave the bed, then even just trying sitting up, switching on a dim light and engaging in a different activity until you're physically tired and you're yawning and you're ready to go to sleep. Again, it's sort of just building this association that when you're in your bed, you're tired, and instead of tossing and turning, it's actually better to leave the room and not to try and come back when you're actually feeling sleepy. Okay. So that's sort of more routine, things that you can try to sort of help your sleep. But we know that a lot of the time, people stay up because they're worrying and they're thinking about things that are in the past or the future. And it's probably the biggest complaint that we have. The biggest worry is about these worries that keep us up at night. So some things that we talk about in the group with patients is the CBT approach, so it's cognitive restructuring. And this is the idea that we actually have negative thoughts about sleep, which are keeping us up. So you might have this sort of automatic negative thoughts that I'm not going to be able to sleep, and that we might be thinking about what's happened or what's not going to happen. And this can actually influence our emotions. We can start to feel frustrated or anxious, which in turn doesn't help our sleep. So some of the thoughts here might be, I won't be able to function tomorrow if I don't get to sleep now. I must get 8 hours of sleep or I will feel awful. So these are some of the thoughts that have become quite automatic with people when they start to go to sleep. And so showing this in the sleep cycle, so this is the idea that these thoughts that we have, such as if I don't sleep now, I'll feel awful, will influence our behaviour. So what we do is we start watching the clock, we're tossing and turning, which then in turn influences our bodily sensations. So you find that your heart rate is increasing, you're feeling tense, which then in turn is the sort of similar symptoms to anxiety, right? It's increased heart rate, feeling tense, sweating, and generally you're in a very tense state, which can then again increase these thoughts of thinking, I'm never going to get to sleep now. So it's this sort of cycle that we have of thoughts, behaviour, bodily sensations, emotions, and that actually what we can do to break this cycle is start with the thoughts and managing them. So it involves reframing these negative thoughts that we have about sleep with more helpful thoughts. So this can hopefully in turn, with time, help reduce worry and other negative emotions that influence and are not helpful for our sleep. Like I said, it does take time because usually negative thoughts are sort of a long life pattern of thinking. But it's just starting and seeing. We'd usually engage the group as well to start thinking about how they, if they have any thoughts that come to mind that might be keeping them awake. And so these are the steps that we can take. So identify the negative thought. So I'm never going to get to sleep. Challenge these thoughts. And this is a process of belief checking, fact checking, and just seeing what evidence do I actually have for this thought, how true is this, and then we can reframe them with more helpful and more realistic thoughts. And the aim of this is just to get a more balanced perspective about sleep and some of the thoughts that we're having. It's not to say to think more positively, it's just to try and think more balanced, and in turn that might help us feel a bit more relaxed and less anxious about sleep if we start to break these thoughts down. And what this process does is it brings these sort of negative automatic thoughts into our conscious mind so that we can sort of start to feel a bit calmer about them. So some of these ways that we might fact check our beliefs that we have is just asking these questions. So what makes me think this? What's another way to look at this? Thinking what's the best that can happen? What's the worst that can happen? And also what will probably happen if I don't sleep? So just some examples you often hear. I won't be able to function if I don't get to sleep now. But it's actually more helpful to think, I'll pace my energy and I'll make tasks more manageable throughout the day. Or I must get 8 hours of sleep or I'll feel awful. It's more helpful to probably try and start to think, I will do my best tomorrow and go easier on myself. So this just shows how taking a more balanced perspective and starting to think more helpful thoughts can actually be really helpful for our sleep and reducing this anxiety and starting to break this cycle that we have if you are worrying at night about things that are in the past or the future. So this can be quite helpful for people. Okay, so that brings the end of that. And so managing worry, another way, worry time, you might have heard of this, is basically to allocate a time in the day, preferably not too late in the evening, let's just say for 20 minutes each day, where you worry, where you write everything down that's in your head. And the idea of this is that if you've allocated a time, it's less likely that you're going to be worrying. It's to try and prevent worries affecting your sleep, because you've got this peace of mind that this is the time that I'm going to think about this and deal with this. And it's not realistic to say we're not going to worry outside of this time at all. But that actually, just the act of writing worries down and splitting these worries into hypothetical what-ifs and real manageable worries that you can actually take action on can be quite helpful. Starting to think about an action plan, who might be able to help you, can actually help give you a little bit of peace of mind, and start to sort of split these thoughts into rational thoughts about worries that you can do something about, and the what-ifs, which might not be the most helpful for us when we're trying to sleep. And so just trying to sort of write these thoughts down and let go of the ones that aren't actually in the here and now and that you can't fix. Okay, and bringing towards the end, the last strategy that we talk about in the group is relaxation and mindfulness. I don't know if anyone practices mindfulness, but it can generally be used for sleep as well, which I'll talk about in a minute. And so this is used quite a lot in the management of anxiety, but it can be really useful for sleep and getting you into that sort of relaxed state. So first of all, relaxation and breathing. So these are practices to help with difficult emotions, like I said, sometimes anxiety. And it's based on this fight or flight system that we have, which is all from our evolutionary past. When we were caveman, we needed this fight or flight system, which is our response to be able to flee or fight or freeze in the face of danger, which we still have today. But it can be quite unhelpful for us when there's not actually any danger there. So what we find is our heart rate increases, you start sweating, you have this tunnel vision, which is all your body's way of trying to focus on a threat, which is not very helpful when you might be trying to sleep or trying to relax. And what we find that because of this stress response, all this adrenaline's going, our breathing can be affected sometimes and it can become quite shallow. You might hold it. And that actually by focusing on a controlled breathing, it can send all the right signals to our brain to start to relax. So one example here is box breathing. So it's the idea of using 4 seconds to inhale and hold, exhale and hold. I'm not sure if anyone's gone through this, I won't make you do it now. But this is just a nice one of trying to regulate that oxygen intake and carbon dioxide out. And that by breathing properly, our body will start to calm and send these signals and activate the right branch of our nervous system to calm down and send all these signals back to us to relax. And then again, breathing practices, they can be used throughout the day. It's best to do this, try and do it for about 5 minutes every day, because at first it might be quite strange, might be quite difficult, but with practice, it can start to feel easier for you, and you don't have to remember to do it so much, you can just start to do it. And there's other types, so there's box breathing, like I said, and there's belly breathing. There's loads out there, but it's finding what works for you. It's not to overwhelm you with all these different breathing exercises. So progressive muscle relaxation, that's another one, which sort of teaches us how we recognise all the tension that we hold in our body, which is actually sending those signals to our brain to be anxious and to be alert. When actually doing an exercise like this, we can start to notice this tension and start to let it go, which again will have the same effect in helping us feeling a bit more relaxed. So that's another technique that's really useful in sleep as well. You don't have to do it lying down, that's just what the picture is. You can do it sitting up. Mindfulness as well. So we talk a lot about this in the group and managing anxieties and worries around sleep. And often we find that a lot of people are aware of it already, but they might think it's sort of meditation, and it's not necessarily. It doesn't mean you have to be anywhere or do anything in particular. It's just about trying techniques to be more in the present. And you find often that our brains are racing and we're having worrying thoughts about the past or the future. This is about trying to break that cycle of thoughts and bring us back to the present moment. And so one of them is 5, 4, 3, 2, 1. And so this is just using all your senses to bring you back. And what this does is actually, by using all the senses, it reorientates your brain into the here and now. So if you're feeling quite overwhelmed with anxious thoughts or emotions, this grounding activity can help you bring you back. So it's just noticing with your senses 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. And if you've not got anything to taste with you, some people carry gum as well. Just what this does is by using those senses, and by the end of it as well, you've spent maybe a few minutes doing this, you might have been distracted from the thoughts that you've been having as well. So again, it can just sort of break that and really slow you down and help reorientate you into the here and now, rather than so much in the past or in the future. Yeah, as always, there's loads of other practices that you can do. There's body scan, which brings more awareness to the parts of your body, and guided imagery as well. So you might have heard of Leaves on a Stream, which is quite a nice video. There's loads out there, but sort of writing worries down mentally, and sort of trying to let them go, let them pass, and also trying not to assign too much emotion to them, too much judgment, and just allowing thoughts to be thoughts, because you can't stop thoughts, and the more you try and tell yourself to not think about something, the more you will. So it's not about that, it's just about recognising them and letting them sort of pass with time. And if it's something you're interested in, there's lots of apps out there, but the one we recommend is Smiling Mind. So it's developed by psychologists, and it has 10-minute guided practices for mindfulness and relaxation techniques, which is free as well. So that's something you can try. And like I said, it's not to overwhelm you with all these different techniques. And in the group, we do go through them and we see what works for different people. But this is just to point them out today. And just to summarise, so we know it's understandable that your sleep might be affected when you're going through a difficult time. But there are some things you can do to help. Like I said, the sleep hygiene, the routine, sleep likes regularity. It likes you going to sleep at the same time, getting up at the same time every day. It doesn't like lions as much as we all like them, but it's just looking at these sleep hygiene aspects that you might be able to bring in to your own life. Also relaxation practices as well, which are a good idea to do. It's also helpful to recognise that just taking small steps can be helpful, and that you might not always struggle with your sleep. With time it might get better, but making small changes and small steps can be helpful. It's not to say you have to do everything that I've talked about today, and it's not to say that it's all going to work, because everyone's different and everyone's individual, and it's finding what works for you. It's also just about knowing that there is help out there. So I said accessing all the resources that I've pointed to. So there's the video, there's the apps, the Sleep Charity is another website as well, Sleep Foundation. It's really useful information. And we also have our clinical health psychology YouTube over at the Royal Liverpool University Hospital, and we actually have some of our psychologists guiding some of these talks and practices that I've talked about, which can be really useful. And that just about wraps up that for today. So bear in mind I've talked for quite a long time. I really hope no one's gone to sleep, but that's my talk for today. So thank you.